اتكلمنا عليها اللي هي Acute Retinal Necrosis Syndrome. انا ليه بتكلم على Acute Retinal Necrosis Syndrome؟ لان احنا ابتدينا نشوف الحالات دي. Unfortunately they are not managed very well and these patients can be saved. العيانين دولت ممكن ان احنا ننقذهم. مين شاف تاني Acute Retinal Necrosis Syndrome؟ انت شفتي؟ ما شفتيش. مين شاف؟ انت شفت. انت شفت. Okay. So these are special type of. So the first time acute retinal necrosis was described ده زمان in 1970s. ايه بقى؟ اورayama ده واحد ياباني actually described this disease. It's an acute necrotizing retinitis, severe vitritis associated with retinal arthritis and late onset retinal detachment. So this was the description of acute retinal necrosis. Where the presentations بقى of acute retinal necrosis بقى episcleritis scleritis. العين بتبقى حمراء. Peribulbar periocular pain معاها severe ocular pain. Acute loss of vision and a triad of occlusive arthritis, vitritis and peripheral retinitis. اللي انتوا شفتوه ده. This is one of my patients. اهو ده واحدة من العيانين بتوعي. So what happens is they get a widespread retinal necrosis taking place mainly at the periphery of the retina. الأبيض ده is nothing but retinal necrosis. Retinal necrosis بتيجي من ايه؟ بتيجي من viral active infection associated with occlusive arthritis. In patient population بتاعتنا بالacute retinal necrosis usually these are healthy patients ودي الخطورة. العيانين اللي هم اصلا عندهم مشكلة اللوكيميك والمعروف لكن ده عيان absolutely healthy. So what happens is you get a sudden diminution of vision and you get vitritis and the typical triad اللي احنا قلنا ايه triad of vitritis, vasculitis and retinitis. انما في مجموعه ثانيه بقى دخلوها معاه في الفتره الاخيره اللي هي العيين بتوع البورن دولت اللي هم immune compromised patients and usually these patients have a different presentation. The presentation بتاعتهم usually the retinitis is in the posterior pole and the reaction in the vitreous is mild. فالعيانين دولت they do not have this severe vitritis. لا الفيتريس بيبقى more or less clear than the typical acute retinal necrosis. والعيانين دولت usually there are herpes zoster. Etiology. احنا قلنا العيانين دولت usually it is the herpes family which is incriminated. And the herpes simplex is the number one cause, followed by herpes 2 and varicella zoster mostly in older patients, and sometimes rare cases with Epstein-Barr. Type A pathology, what happens in these acute retinal necrosis patients? A full thickness retinal necrosis, احنا قلنا, as a result of invasion of the retina by these herpes or the viruses. And you have choroiditis, retinal arthritis, and you find viruses in all the layers of the retina. So is it a clinical diagnosis? Yes, it is a clinical diagnosis which can be helped by PCR. PCR is a aspirate. You aspirate from the vitreous and you do a PCR in these patients and you can detect the DNA particles of these viruses. So it is a clinical, but the American Uveitis Society added some in addition to the clinical features, you can have either retinal necrosis with discrete borders. These are the clinical features and some supporting clinical criteria like optic neuropathy, scleritis, and pain. These can clinically assess your diagnosis. ايه الديفرنشال diagnosis بتاعنا ده مهم. CMV retinitis. CMV retinitis is different from acute retinal necrosis. احنا قلنا CMV دول عيانين usually immune compromised and the picture is different from the picture we saw a few moments ago. Or Rift Valley fever. احنا قلنا برضك Rift Valley fever. It's again a viral retinitis affecting the central part of the retina as caused by the arboviruses. Ocular lymphoma. But the ocular lymphoma, they have the choroidal and the peripheral lesions, and sometimes على فكرة it's difficult to diagnose these patients and to differentiate them from acute retinal necrosis patients. Behçet's disease, على فكرة Behçet's disease is also associated with severe vitritis and sometimes inactive Behçet. You can have areas of peripheral retinitis بس ما بيبقاش the large areas of retinitis اللي احنا شفناها. And the acute retinal اللي احنا vancomycin associated retinal vasculitis. طيب العيانين دول بنعملهم ايه؟ It is crucial that these patients should be managed quickly. Number one is to diagnose the patient that this is the acute retinal necrosis by the clinical feature. Clinical features you see here are diagnostic, and you have to have a high suspicion level. Prompt intervention required in the form of systemic acyclovir, intravenous acyclovir every 8 hours for at least 14 days, يعني 2 weeks. And intravitreal gancyclovir اللي هو سايميفين اللي هو gancyclovir ده موجود بندي بندي مرتين في الاسبوع with this dose. This is very important in order to get the proper dosage inside the eye and to save the patient's eye. And sometimes you can use valacyclovir اللي هو الvalsite as well for 10 days is important. And sometimes you need to do a pars plana vitrectomy and the silicone oil زي العينين اللي هوريها لكم دلوقتي. Prognosis in these patients. Well, الحاجة الخطيرة and sometimes the fellow eye is affected even in a healthy patient. So it's a visually devastating disease, and if you do not interfere early on, the eye will be lost very quickly within few days. So poor visual outcomes may be expected, and it can be sometimes the clue of diagnosis of immune compromised patients. هديكوا بقى ايه عيانة واحدة من العيانين بتوعي. So this is a pharmacist, 46-year-old, healthy, no medical problems. She had very severe periocular pain, drop in vision, and at presentation she had an 0.2 vision with severe vitritis and these peripheral lesions. وبعد كده العيانة دي اختفت ورجعت تاني at a hand motion vision. So I decided to do a vitrectomy. ده العيانة اهي. This is the typical severe vitreous haze in these patients with acute retinal necrosis. عشان اقدر اشوف you need to remove the whole vitreous properly and you are left with these peripheral retinal lesions. Typical acute retinal necrosis. Widespread conglomerate of retinitis. Type. After you remove that, الحقيقة شايفين كمان the retinal vasculitis, the vessels are occluded. You may elect to do laser photocoagulation at the edge of the retinal necrosis because these patients will develop retinal detachment because the areas of retinal necrosis will end up in holes, atrophic holes. The exudates on the retina. طيب العيانة دي للأسف بعد ما عملنا كل الكلام ده she developed a retinal detachment, and this is the patient few weeks later on. She had a retinal detachment, particularly at the area of the retinal necrosis here with severe proliferation, and she lost vision in this eye. طيب ده عيان تاني اهو. This is another picture. This is another patient. العيان ده كان عنده acute retinal necrosis syndrome, and you see that the patient had a total retinal detachment. This is the area of the acute retinal or the retinitis with atrophic holes all through. العيان ده actually you need to remove all the atrophic retina, and you're left here with an area of central vision. والعيان ده كان بيشوف 61 في الاخر اهو. You removed all the retina there, and we are left with the central vision because the acute retinal necrosis typically affects the peripheral retina and spares the central part. عيان تاني اهو. This is another patient with acute retinal necrosis. Typical vasculitis. شايفين الريتنا is detached with occluded vessels, completely occluded vessels, and atrophic holes at the periphery of the retina. Take home message: acute retinal necrosis is an ocular inflammatory condition with devastating effects on vision, and you have to diagnose the patients early on because you can save vision if you interfere properly at the right time using the dosage and the proper antiviral drugs, whether systemically or intravitreally. Rapid and early intervention with antivirals may save some vision. Acute retinal necrosis will be the first sign of immune deficiency state, so you have to really investigate the patient properly. Pars plana vitrectomy, long-term silicone tamponade, is often indicated to treat the delayed onset retinal detachment. وشكرا. These are طبعا النهارده شفنا بقى الريتنال فاسكولاتيس والريتنال ريتينايتس فايرال ريليتد. عندنا كذا نوع من الفايرال ريليتد ريتينايتس: acute retinal necrosis, CMV, Rift Valley, HIV, dengue fever, West Nile fever, زيكا فيروس. زيكا، مين عارف الزيكا؟ موجود فين؟ في البرازيل. في البرازيل حتى اولاد الزيكا بيطلعوا ايه؟ عندهم ايه؟ مايكروكيفالي. and the COVID-19 اللي احنا بنشوف دلوقتي عمالين نكتشف الكوفيد-19 era حاجات جديده ما كناش نعرفها. and thank you very much. اسئله؟ طبعا خلاص انتوا خلاص. حد عنده اي اسئله؟